The International Continence Society defines incontinence as the involuntary loss of bladder or bowel control, and the World Health Organization recognized incontinence as an international health concern. In the UAE, a local urologist said that many residents suffer from this. However, it is often unreported and undiagnosed due to the stigma often attached to it. 3 months ago, the Neuro Spinal Hospital added urology in their portfolio to raise more awareness, prevention, timely diagnosis as well as proper treatment. Khadija Salih has this reporter.
Across the globe, men and women suffer from urinary incontinence. However, it remains underreported and undiagnosed because of the stigma attached to it, as well as the misconception that the disease is only for the elderly. This, along with other diseases related to the urinary tract, may develop to something worse if left undiagnosed, according to Dr. Ramiza Atasi, a urologist at the Neuro Spinal Hospital in Dubai.
It's usually started with neurospinal surgeries and problems. After that, they added orthopedics, and now for the last 3 months, they have started to include urology, because I want to remind you that an important part of urology deal with neurogenic or neuropathic bladders. And since this hospital is a neuro hospital, many of the patients coming here, they have what they call it neuropathic bladder.
The World Health Organization has recognized incontinence as a global health concern. Its social costs are high, as mild symptoms also affect interpersonal and professional function. Dr. Atasi said it affects everyone, including children, and the reasons range from stress to environmental factors.
In the young people, the urinary incontinence problems would affect their quality of life, and this might affect them by psychologically, or have the impact on their production and their jobs and their exercise, etc., etc. Elderly patients also, if we ignore some of their urinary incontinence problem, it would affect the kidneys, because any obstruction or any abnormal passage of urine would reflect on the kidneys by causing back pressure changes and entering in renal failure.
While there are no statistics available yet in the country, Dr. Atasi says many residents in the UAE are prone to developing kidney stones. Prostate cancer is also another concern.
One of the problems of these countries also is the stone formation. The stone formation is much higher statistically than the Nordic countries, for example, because of the part of the problem of the stones is caused by less drinking of water, or decreasing the amount of drinking of water. Cancer of prostate usually starts by the age of 45 or 50. I would advise men at this age to come to have an assessment, earlier assessment, to be able to follow up later.
The urologist also added that awareness is key to a better well-being.
Preventive medicine is better than cure. So in this case, avoiding on time, don't delay yourself. Don't say later on I will find a toilet, or so this sort of misbehaving with the bladder should be also avoided. As I have told you, also some sort of drinking and some sort of social thing like alcohol, it would affect negatively also the bladder, because the bladder with the time it would be affected from inside with this sort of toxics.
The population's health remains a high priority for the UAE. Advanced technology and the growing number of specialties are widely available in the country. It is hoped that more patients will take an initiative in securing their own health by seeking medical help early. Khadija Salih, 7 National News.